patency that I should be aware of? No, okay, I'm gonna check their nasal patency by having them breathe through one nostril and then the other to see if one doesn't have air passing through it. I'm putting my hand, I've done my hand hygiene, I'm putting my gloves on. This is another thing where once you start doing this, your hands are gonna be really slippery and covered in lube, and so you wanna kind of prepare as much as possible ahead of time. So I have my towel here, and I'm gonna kind of do it like this, because I'm gonna use this space a little bit for my tube. Will you throw me a stethoscope as well, please? So I tend to, you don't need to do this part for your video. This is what I do in practice. I tend to hook my one thing here so that I can just go like this when I'm ready to check for air.
Smart.
Yeah. So I'm gonna do my measurement. I'm gonna open this. This is my securement device. And then it comes with skin prep. So I'm gonna open this. Doesn't really matter how you open it because it's clean. And you're supposed to be able to peel it apart here, but I always find that difficult. And a little tear here. I'm gonna measure Miss Tran, nasal to ear, ear to xiphoid. That's at 50, then I'm gonna add 10, I'm gonna go to 60. Okay, so now, I don't have any lubricant, can you throw me a mineral oil?
Yeah.
Now I'm going to prep this. So in order to aspirate GI contents for your pH strip, you need to be able to aspirate, which means you need to connect your 60 cc syringe ahead of time. Notice that my NG tube comes with this little connector. This connector is for suction. So you're just gonna take that off, set it aside, do not lose it. Then you're gonna have this on here. I like to have it a little bit of air because for my clinical purposes, I like to check air to make sure I'm not in the lung. So now I'm gonna kind of put this here. I'm gonna put my lube on. This doesn't have to be sterile. So I'm gonna lube this up. And then I'm gonna say, okay, Tran, we're gonna start putting in the NG tube. You're gonna start feeling this come through your nose. I want you to tuck your chin to your chest, and I might help them do that. Or I also like to have my hand right here on their forehead if this is gonna be a person who goes and then starts shaking their head because they hate what we're doing, which is much more common than you think it is. And that's because as I'm inserting, I can kind of hold on to this and have a stable point on their forehead, not poking them in the eye, and making sure that this isn't coming out as they're shaking their head, because what have they suffered for if my NG tube is just about to come out anyways. Right, so I'll help them tuck their chin to their chest. When they tuck their chin to their chest, this helps them close their airway off and open up the esophagus. So it just it's another way to prevent the NG tube from going into the trachea. So now I'm gonna go at a straight back angle, like you're throwing the dart. Not up, straight back.
Just along the floor.
Yep. Because remember that picture of the nasal passage, it's flat, right?
Yeah.
So around here, you're gonna start seeing the holes, and around 10, this is when you're gonna start feeling it turn to go down in through the nasopharynx. And around 20, this is when you're gonna start getting to where their gag reflex is. You're gonna start encouraging them, okay, I want you to swallow. So if Tran was able to swallow, I'd have her holding this cup and taking sips of water as I was doing this. This is where I would really want to make sure she's taking the sips of water. Okay, go ahead and swallow, swallow, swallow for me. Keep going. Keep going. If you feel some resistance, you can do a little bit of forward with your wrist, but again, do not engage your bicep because you don't want to puncture the esophagus or the lung, right? So on these mannequins, you get, actually most of them you can only go to like 35-ish, 40 because they have a little pouch there. So in your videos, you're to say, I would go, the mannequin is gonna stop me from going all the way, but I would go to where I measured at 60. This guy's, she's letting me do it.
If
so
somebody's
I'm gonna go.
conscious, it's often better to kind of start sniffing position, and then as soon as you hit that kind of coughing thing, then you tip down, because you don't want to cut their airway off if you're taking forever to do it, right?
Oh, so
Yeah.
like
So you want to,
starting to
it's kind of a
relax.
fast thing with conscious people.
Yeah. I always have them be like this, personally.
From the start.
Like with their chin tucked down.
Uh-huh.
Really?
So now I'm at 60. So now I'm going to hold it here because I don't know that I'm in the right place. I'm not going to secure it yet. So one way to check to make sure you're in the right place is, this is why I do this ahead of time. I'm just going to tuck this here. I'm going to have maybe a buddy hold this here, or I'm personally going to do this. And I'm gonna, as I inject air, I'm listening for a burp sound over the stomach. If you don't hear that, maybe go a little higher, inject some more air, and if it sounds like a breath sound, you're in the lung. You need to come out. This, again, is not gold standard or of a check. It's not even really evidence-based anymore. But it is a good, just quick check to see if you're definitely in the lung. If you hear a burp in the stomach, you can feel somewhat confident that you're in the stomach. So the other way to do this is to aspirate some GI contents. So you pull back until you get a little bit of bile in here. And then you're gonna disconnect. Notice how my hand is really stable up next to her face. I kind of have my hand on the cheek. I'm not allowing. Yeah,
Sorry.
it's the
Mineral
lube.
oil.
Oh, it's the lube.
She's what?
It's like a house.
She said she's drooling. So I have my hand stable up here. I'm not allowing it to come out. And that's because this is a really lubricated thing. If you let go, it's gonna start coming out. So I'm gonna check my aspirate. Okay, this is acidic. I'm gonna secure. So for this guy, it looks like a little bone. The top one part of the bone goes on the nose right here. We're gonna put on the skin protectant. The skin protectant is gonna prevent this from getting skin tears, and it's also gonna make it a little bit stickier so that these don't pop off. People's faces get sweaty, and these kind of come off easily. But the skin protectant helps with that. So you're just gonna put it on like this, and then pull this part off. Because this mannequin's made of silicone, it doesn't stick great, but it sticks on those mannequins better because they're made of plastic. And then you're just gonna push it here. I personally never do a super great securement on the nose that's like foolproof until I know I'm in the right spot. And then after my chest x-ray is confirmed, I'll come in and really make sure that my securement is great.
Which in your video, I think it says tape it,
Yeah.
and then it says secure it once confirmed. So just verify that in your ATI sheet.
So then, do you have the little rubber band?
There's one under the packaging there, right?
In front of the middle, or back of the middle.
Oh, there we go. Okay, thank you. So then, another thing that you're gonna do is secure it to their gown so that it doesn't like hang down like this. You want to make sure this vent stays above the stomach, because if it goes below, it'll start just pouring out gastric content. So you're gonna use this to create like a little securement here, and then tape it to their gown. Or safety pin it to their gown, like that.
Sometimes if I don't have anything, I'll use like a piece of tape and use it as a flag, and then I'll use a pin.
Yeah. So then you're gonna get your chest x-ray to confirm your placement. I'm gonna show you how to connect it to suction, but you don't have to do this for your videos. We're gonna come over here to your suction device, your wall suction.